Hello, everyone. My name is Bettina Borisch, but I have the pleasure to be here today with Rocío Sáenz, an extraordinary person. She is a professor of health promotion. She is from Costa Rica, a country that does interesting things. She has done so many things in her career, in between being Minister of Health from 2000 to 2006, to teaching and promoting. But I think foremost of all, Rocío, you are an advocate. You are advocating for health of all people, for equal access, and that is really what I admire. So, dear Rocío, thank you for being available with us. And let me start our interview with going to the pandemic that is still ongoing. You are from Middle America, from the Latin American countries. How did you experience the pandemic? What did you learn? And what could governments in general learn from your point of view?
I think the most important during the pandemic was to really the pandemic show our inequalities. The inequality that was before the pandemic, but the pandemic was like a photography and how we were about the social inequalities and also some problems and inequalities in the health system. This is, I think, the most important that we learn. And with this panoramic was very interesting how the important is to strengthen the health system based on primary health care. The system that has the base of the health system on primary health care has more opportunity to respond, opportunity clearly and efficiency for the population. And I think this is one of the biggest lessons learned that we have in our region.
If you're talking about this, could you give some examples of really important health inequalities that you saw during or even reinforced with the pandemic?
For instance, we have experience in Brazil, in Chile, Colombia, and Central America, Mexico, about how the population shows the poverty and the difficulties for the women, especially, to stay away from the work and the workforce about the first days in the pandemic. This not allowed to ensure the income for the family. This was one of the examples that was very interesting, especially in Brazil for the people in the Amazonas. They take their own decision to state protect because they don't receive any support from the government at that moment. Was their own community that has to really support each other and protect themselves and receive the information even from the other countries, because they not receive special attention, even that we know they are living in very rural and insulated areas. This is one of the examples, but the other example is how the women can handle the situation at home, but also care the children, care the elderly, even if they lose the job. Our economic commission from the Latin America show how difficult it is for the women to reintegrate to the workforce. Was more easier for the men than the women. And this is one of the difficulties that we still have today. And in the other hand was the gap that we have at the technology. to the people to really receive all the information, real and good information, to protect themselves. And of course, the corruption and the misinformation was spread all over the region. And this is one of the aspects I think we have to take in mind in the next pandemic or in the next sanitary crisis.
Thank you for mentioning one of the very important inequalities that still reign between men and women. And thank you also for this example, how people then themselves started to create self-help, as you mentioned, Amazonas. But let me turn it the other way around. Did you see examples of policies that really helped in this situation? What could have been done? What really works? Did you see examples of good policies that helped alleviate the consequences of the pandemic?
For instance, in Costa Rica, we have the example that the government protect the people who stay out of home, the homeless, and they keep the person in shelter, special shelter, and also bring some economic support during the first months. I think for 6 months, they receive the support from the governments, and also how to bring, of course, the vaccines. That is very important because the vaccine is the way to protect and prevent the transmission. Also, how to protect the health workers. That's very important because the government has to take the decision that really protect the people who is in the front line of this pandemic. We have the case of Costa Rica, for sure, but also Panama, Argentina, and other countries take the decision to really to protect the people, starting with the social determinants of health. And I think this is very important because it's beyond of the health system. And this is how the society as a whole protect the most vulnerable populations.
Thank you for these different examples from Latin American countries. So policies that work. And for our audience here, I don't know if everyone knows, Costa Rica is for me the amazing country that has no military, but put the money into health and education. So in fact, it's interesting to look at Costa Rica as a country, how they manage. But let's turn, Rocío, to something that's coming up in May, our World Congress of the World Federation of Public Health Associations in Rome, 2 to 6. What do you think? What of the policies could be discussed there? Would you think that that's a good place for exchange? And how could the Congress help bring change to more places? Because you have mentioned the countries with a very weak system and others who tried to really implement policies. What would be the enablers for such a change?
I think the most important is how to keep the leadership on public health. What does that mean? How to put the well-being of the population in the center of the decision of the policymakers. It's not only to talk about the suppliers and solo or about the workforce. It's also how to really put in the center of the decision the people, the population, the communities with a collective view, and how to bring the intersectoral approach to help the health system, because the health system doesn't has the role for all the society. But if the health system doesn't make goodwill, all the population will suffer. And for that, it's very important to keep this leadership in the center for the population, but also try to understand that in this work with the high technology, with the high communication, with the high internship, with the interdependence that we have between the big countries, the small countries, the rich countries, the middle income countries, the low middle income countries, the people who is at the school with the people who are at the university who are working. All of us has to be well to really save the world and go beyond to attend the emergency or the crisis.
I feel behind your words the passion for health equity that you have, and let me ask it in a more personal way. How did you become so passionate about health equity? What are the sources for your energy that you put into your work for more health equity?
I think it's because I have the values from my own family, my own country, but also I have the strong experience in how we can make the difference. This is related to our own responsibility in our own generation to really not only survive our life, but also how to go beyond and has this intergenerational commitment. For that, I think this is a very important to work together and share the ideas and try to learn and really keep going, como like I will say in Spanish.
So this really leads, for me, you said the next generation, the intergenerational, leads me to the question, what would be your advice for young public health professionals? What would you tell them? What would you like them to do?
I think is the most important for the next generation is try to keep the public health as a value in the own society. And what does that mean is that the collective approach, the working together to know the communities, to working with the health workers in the front line, to know the reality, be to the context, go into the context, live with the people, sense the feeling of the people, recognize that we are a professionals, but we don't have all the knowledge. We have to really try to understand how is the people live and how they sense and how they build their own life. And with that, we share these two ways from not top down, not only bottom up. It's how to be collaborating together and to try to understand. Because if we don't understand the reality, how they live, how they resolve the problems, they have a social network or no? Maybe we have the idea that everyone has the social network, and this is not the reality. For that, we have to understand that and build on that in that reality. Build the intervention, the knowledge, the analysis of the health situation, and also build of course the response of the programs, and together evaluate. It's not only to receive the information from the communities of the person, is how to design the intervention, and then we have to look together how they will change the situation. And I think this is one of the biggest issues for the next generation, and be very proud to be public health professional.
Thank you so much, Rocío. What a great message to our next generations. And I hope a lot of them will be able to meet you and to learn from you. I can only say thank you very much, Rocío, for being with me and for having taken the time to do this interview. I send my warmest greetings to Costa Rica and looking forward to meet you. Thank you, Rocío.
Thank you, Bettina.